let's talk about some of the resources that are available for us. We wanted to introduce Dan Gillison, who has just started his position at NAMI. So Dan, why don't you tell us a little bit about NAMI and your mission and some of the resources that NAMI brings together so that individuals who might be feeling that anxiety, the sleeplessness, all those different symptoms that Dr. Saundra Jain mentioned, what kind of help and resources and tools might you have?
Yeah, well, thank you very much. And to my colleagues, thanks for all that you are doing. We very much appreciate it. And Mary, we really do appreciate you bringing us together to have this voice and to be able to provide information. So appreciate it. In terms of NAMI, it's the grassroots organization that started about actually 40 years ago by a group of mothers who's sitting around a kitchen table and their sons were living with schizophrenia. And they were looking for resources. The mothers were looking for resources for their sons as patients, and then they were also looking for resources for themselves as family members. So this is a grassroots organization that started out of those interactions to actually provide resources for families and for individuals living with serious mental illness. So it has grown over these 40 years into an organization that's got over 600 affiliates and state chapters that provide resources, training, and act as the patient advocates in communities all over the United States. And it's staffed by volunteers, individuals with lived experience, and other individuals who look at this as their passion to give back. So that gives you a little bit about the National Alliance Mental Illness. Prior to this experience for me, to this conversation, I think it's important that I was the executive director for the American Psychiatric Association Foundation. And why do I mention that is because of my friend Rakesh, who I met before, I believe in a meeting in Dallas, if not at another meeting. But what's important to this is that a lot of my colleagues that I spent years with the foundation, they are all medical doctors, and a lot of our psychiatrists are going into the epicenters of this epidemic, this pandemic, and providing their services. So I wanted to stop and just give appreciation for them as first responders. A lot of times you will put the title psychiatrist and you don't recognize that these are doctors who at this time are going into the epicenter and providing their medical expertise. And then from the psychological standpoint, as I think through it, I go back to a press conference that Governor Cuomo did, and in one of his earlier press conferences, he told the audience, he said, I want to make sure you all understand we're fighting two very difficult things here. And he said, I don't want to discount either one of them because they're both as critical. And both of them, one was COVID. He said, one is COVID. We hear about that in this press conference. But the other one that I want to address right now with you all is fear. So he made that announcement and that pronouncement in one of his early interviews, and then he went into what does fear look like? And that's what my colleagues have just spoken to. What we are doing at NAMI in terms of resources, the first thing we're doing is we wanted to make sure that we took care of our staff because they can't take care of others unless we take care of them. So self-care. We needed to we have a helpline. And we had just moved into a new building less than 7 days from when COVID, the pandemic hit. So our helpline was brick and mortar, computers staffed in our new office, and we needed to actually move that to virtual. And so that was one of the first exercises we had to do, amongst also moving our staff to working virtual. So we stood up a continuity of operations team. We put that process in place and moved all of our work virtual. The other thing we stood up was a COVID team. That COVID team works on the communications, the outreach, and the messaging from the standpoint of what we have. So that's a part of it. So it's our website is one of them. Our chief medical officer, Dr. Ken Duckworth, has done probably about 22 to 24 interviews. everywhere from the BBC to being interviewed for the Chicago Tribune and LA Times and some others. So we're trying to do that outreach there. We have created a website, NAMI.org/COVID-19. We have an information guide that we've created there that has frequently asked questions. What do I do about my medications? What do I do about this? How do I take care of myself? How do I take care of my child? We also, as the patient advocacy group, we do our in-person trainings because that is the way that you get the communities of practice of people talking to each other about their experiences and their deltas between what they need, what they have. So we've been doing all of that over the years in person. So with this pandemic, we now have to look at a new way of delivering our curriculum, our peer-to-peer curriculum, our family-to-family curriculum. So we have moved a lot of that online and trying to help all of the participants in the communities get online to access that training. And to still stay connected. But because staying connected, we're finding is most critical. The other thing that we're doing is we're partnering quite a bit with our strategic partners and our ambassadors to produce public awareness messages and PSAs. And we are also working with Instagram and Facebook to message out. We've created, last but not least, we've created a coronavirus mental health support fund. And we've stood that fund up because we're getting so many calls from our partners that we've worked with over the years that have called us and said, what can we do? So we stood the fund up so that we can execute seamlessly as they ask what they can do, and they want to provide resources, funding to help us do that. So we're using that vehicle to immediately be able to take whatever resources they provide and deploy them into resources out into the field. So that's a little bit about what we're doing, and our helpline is up and running, and we're at about a 200 to almost 300% increase in the number of calls that are coming in.
Dan, thank you so much. That is great. So let me turn it over to Michael Pollock. He is with the Depression and Bipolar Support Alliance, and they have created some new support groups in response to the COVID-19 crisis. I know that one of the things that DBSA also focuses on is wellness, which I think is very, very important at this time. It's mental wellness as well as general physical wellness, which go hand in hand. And I think we're appreciating that greater and greater. Michael, please share with us some of the tools and resources and tell us a little bit about your organization.
Yeah, thanks, Mary. And thanks to everyone on this panel. I think before this crisis, we would all agree that the mental health system in our country was subpar. And in a crisis like this, we're seeing how these issues are getting exacerbated. But I do think the one opportunity is it's creating opportunities for us all to come together and figure out how we can improve access to mental health support for people who are looking for it. The Depression and Bipolar Support Alliance is celebrating its 35th anniversary this year. 35 years ago, similar to the origins of NAMI, was started by two individuals who live with bipolar disorder. And they wanted to not just talk to their doctors about their condition, but they wanted to talk to each other and other people who live with mood disorders. And through that effort, the concept of peer support for people living with mental health conditions got started. 35 years later, DBSA has about 500 support groups meeting around the country on a regular basis. Most of those groups meet weekly. And as you can imagine, with the COVID-19 virus and the need for social distancing and for people not to gather in groups more than 10, and many of our groups were meeting at hospitals and churches and other public settings that have now discouraged outside groups from convening. Nearly all of our in-person groups around the country have been suspended. And so we have kind of a three-tiered approach for how we're now addressing the situation so that peers can continue to engage with others in similar situations as an element of their wellness and their treatment plan. With respect to our community groups, there's always that group that are the early adopters. And so I'd say about 20% of our chapters have already moved now in just the last few weeks to providing video conferenced support groups. And we're meeting with the leaders of those chapters on a weekly basis. And so we've had 3 or 4 weekly meetings just to talk about the experience. And I'll say just over this short period of time, the general mood from the leaders moving in this direction has gone from sheer panic and how are we going to do this, to as recent as yesterday, celebrating some of their successes. And not only have they figured out the technology on top of just the skills of running a support group and how do you communicate that, but they're getting creative in terms of some of the ways in which they're supporting one another outside of the group, having meals together, playing games together, that sort of thing. So there's some optimism as part of what we're experiencing. But I mentioned that's about 20% of our chapters. So the next goal is to focus on the other 80. Many of those that come to our support groups are older. They may not have the technology or the skills, or just the fact that they're dealing with change. How do I work the camera? How do I work the microphone on my tablet or on my laptop? And that's an added anxiety on top of what we're all experiencing and what we've been talking about as part of this discussion. And so helping more of our support group leaders get comfortable with making this shift will be our continued focus. On a national level, we had already been offering support groups, mostly for people that are not geographically in proximity to a local chapter. We had been offering 6 groups on a weekly basis. We've expanded that to 11, and soon it'll be in the teens. We're continuing to add more support groups. Even with the addition of our national support groups, we're seeing the waiting list to get into the groups. Those lists are longer than the actual number of participants. We have a group meeting today that has about 3 times as many people on the waiting list as that can fit into the group. And sadly, that 3-to-1 ratio is becoming the norm. So similar to NAMI, we've set up a fund to help expand resources so we can continue to add more national online support groups to meet individuals. And then lastly, we know there are some specific groups in our society that are extremely vulnerable, and they were vulnerable before COVID-19, veterans and seniors. So we continue to offer more resources to veterans in our country. We're about to set up support groups specifically for veterans, as well as for seniors who are living longer, living more independently, but often are isolated. And as seniors are being screened for depression, we're not only creating support groups, online support groups for them, but through our peer support specialists. These are individuals with lived experience who have been trained and certified as a paraprofessional, not to replace the role of the medical doctor or the therapist, but as an adjunct. Those peer support specialists will begin to offer one-on-one telephone peer support to seniors living with depression in different parts of the country.
Wow, that's wonderful. And I'm so glad that you mentioned some of the special populations who might be at different risk, if you will. Dr. Jain, you work a lot with young adults and youths, and obviously they're very social, and right now they're out of schools, they're being homeschooled at home. And while they are social, I think digitally, I imagine that they probably have some unique mental health challenges. So what are some of those right now? And can you give some hints or some advice for parents and for those individuals, maybe young adults?
Yeah, Mary, as I'm listening to you and to Dan from NAMI and Michael from from DBSA, I'm almost wondering if what we are wanting to do and needing to do is start another pandemic. But this time it's going to be a pandemic of hope, of connection, a pandemic of resilience, and perhaps even a pandemic of wellness. Why should virus be the only one that gets to claim power over us? Why can't we and shouldn't we stare it down in the face and use the resources we already have? I guess what I'm saying is let's reject powerlessness, which is what we felt for sure. I think it's time to reject it as best as we can, realistically, and claim our own inner wisdom, our own inner abilities, and our own ability to seek and receive help from others, as both DBSA and NAMI are doing at a national level, and we try and do it at an individual level. And Michael, you're right. It's a team effort. Dan, you're right. This is not a matter of, I'm going to do this, you don't do this. We all do this together. And the very fact, Mary, you are moderating is this conversation shows we're all in this together. Now, in regards to your question about youth and young adults, they are vulnerable. And they're vulnerable for several reasons. One of it is they are getting this pandemic at the wrong time. Their mental health challenges are at rates I've never seen before, and I have been in mental health field for 30 years. So they were already vulnerable before we started. The second is they often don't have great financial savings. Often they're about to leave their nest, or they have left the nest, and their family, in many ways, are their friends and their work. And that's all of a sudden being disrupted. So here I am sitting with Saundra. Sure, we are disrupted, but as a married couple, we have each other. Now, for poor Saundra, she has me 24 hours a day. And all kidding aside, we have each other. These young individuals don't have that. So when they flock out seeking human company, I feel their pain. I understand it. So now that I've talked about the worries, I think we should also perhaps understand how uniquely positioned they might be to receive that kind of help that Michael and Dan, you both articulated. They are very connected. They know how to use the iPhone. They know how to use social chatting. The only challenge is most of what they get is breaking news. Breaking news, oh, Washington, D.C. is in trouble. Chicago's in trouble. What about this breaking news? That DBSA online is about to have a conversation on resilience. Is that not breaking news? Is it not breaking news for them to hear that they have suffered from depression, but NAMI perhaps is offering them resources online that they could share with their friends and with their family members? Those are all breaking news too. We're just not doing this in a fair, balanced way. And I do think the youth may be very positively susceptible to the message of wellness. Now, it is also true some of them, in fact, many of them are already receiving medications or psychotherapy. And just to address that, Saundra and I and my colleagues, thousands of them, have very rapidly adopted video visits. So online therapy visits, by the way, which goes quite well, and online medication checks when appropriate. Pharmacies are helping us. Pharmaceutical companies are coming in and partnering with us. It has been wonderful to see America become, in my opinion, what America was always all about, which is togetherness. And we will need to do that in order to help our youth. So I'm worried about our youth, but not pessimistic about their future at all.